This is Channel 2 News, coverage you can count on.
The plan gives Nevada more money to cover health care costs as it sees fit.
Senator Dean Heller is one of 4 Republicans sponsoring a new health care bill. If passed, the proposal would repeal and replace the Affordable Care Act. And that is our Channel 2 News big story at 6:30. Good evening, everyone. I'm Kristen Remington.
And I'm Landon Miller. Thank you for joining us tonight. If passed, the Graham-Cassidy-Heller Johnson bill would essentially create, it's a long one, but it would create a block grant that would go to the states every year. Paul Nelson joins us live in the newsroom after learning more about this legislation. Paul?
Yeah, Landon, the proposal would end the individual and employer mandate, and it would repeal the medical device tax. The sponsors say the ACA's taxes on the wealthy would stay put, and that the grant money would replace federal money used for things like Medicaid expansion, the ACA Obamacare tax credits, and other subsidies.
For the third time this year, Republicans have a proposal to change the healthcare system as we know it. The plan would protect patients with pre-existing conditions, and people would not be fined if they don't buy health insurance.
We spend in the state of Nevada, pay the federal government over $18 million by individuals, about 80,000 of them, because they can't afford the product that the government tells them they have to buy.
Republicans say California, Massachusetts, and New York get 37% of the ACA's funding, and that this plan would level it out to all states by 2026.
So under this proposal, our proposal, Nevada actually receives more funding than we currently do under Obamacare.
Each state would decide how to use the money, whether it's for their own version of the ACA, a single-payer system, or a different program.
And it returns powers to the states, provides ultimate flexibility to governors and legislatures, regardless of whether they expanded Medicaid or not.
Last month, Governor Brian Sandoval announced that Silver Summit will cover the health exchange in Nevada's 14 so-called bear counties, keeping 8,000 people from losing coverage.
Unfortunately, we found one carrier, which means there's no competition and there are no choices, and you know that that's only going to increase costs in those 14 to 17 counties.
The bill would require 50 votes, plus the vice president's tie-breaking vote to pass before the end of the month deadline, when Democrats can filibuster the legislation.
This is the way forward. This is how we're going to move not only health care forward, but America forward, our economy forward, by having a health care plan that works for everyone.
Democrats called the legislation destructive. Meanwhile, Senator Bernie Sanders unveiled his Medicare for All plan yesterday. That's not expected to gain much traction in a Republican-held Congress. Covering the big story live in the newsroom, Paul Nelson, Channel 2 News.